I was just turning 45.
I remember looking down at the floor.
The doctor says, "You have cancer."
It was the most unbelievable thing I had ever heard.
I was like, this can't be true.
How did I get this? Was there anything I could have done?
Just to hear the word invade our home was devastating.
And for him to look at me with that distressed look, it was something I'd never really seen before.
But I was at work that day and I got a phone call from my dad. All he said to me was, Chris, I've got cancer.
It's like everything's over. What's next?
I was scared to death.
Someone who's always been there for every part of your life may not.
It takes the wind out of your sails.
To be confronted with the fact that there's going to be my funeral is coming real soon. It's one of the hardest things in the world.
There's such a lack of awareness of prostate cancer. Even though it is as common as breast cancer, people don't talk about it.
Most men don't even probably know what the prostate does, where the prostate is.
Didn't even know where my prostate was, for Pete's sake.
He said that he was going to go to an oncologist. His reaction was almost like he was suffering from a cold.
My husband is the type who is allergic to doctors, never wanted to go.
We're men. We think we're Superman.
Nothing could stop me, and that's the way I felt.
I live a pretty decent lifestyle.
When a man feels good, a man feels good. There is no need for a doctor to interfere with his feeling good.
Because it's easier sometimes not to know and to be in denial. To be quite honest with you, Bob would be dead now if we had not asked for that test.
When they are first diagnosed with this, all of a sudden they're strangers in this foreign country.
And you almost feel like a kid trying to look for a needle in a haystack.
We received so many conflicting recommendations.
I had to find some information. I had to do something.
There's gotta be something I can do. That's the hope in it.
Education really takes away the fear from having to go through something like cancer.
If you don't become a student of your diagnosis, you're just flying in the wind and people tell you things and you run with whatever you heard.
Sometimes it's so overwhelming. So to have a place where you can go where there's trusted information is really helpful.
It gives you a foundation for something that you can count on.
And to not let this disease defeat the quality of your life.
Somewhere along the line, we have to dig for hope. Hope is what keeps living alive. And so on his worst day, I had hope that it was going to get better.